So based on injury, the type of injury, the spinal cord injury, we can classify it as either a complete injury or an incomplete injury. So you see, we call it complete injury when the sacral segments are also involved. So people with no sensory or motor function below the level of spinal cord injury around the anal area, that is S4, S5. This yellow part showing here. So incomplete injury is there's preservation of some function below the level of spinal cord injury. That is below the sacral levels S4, S5. So again, on the basis of the amount of involvement, we have the paraplegia or the quadriplegia. So paraplegia is when the thoracic, lumbar, or sacral segments are involved. We get this paraplegia, and quadriplegia is all four limbs involvement when there is cervical injury. That is cervical segments between C1 to T1. So what does the spinal cord injury cause? It causes some limitations. What are those? So these are mobility. The patient has difficulty in mobility, ambulation part. Next, self-care, like dressing, bathing, grooming, that is activities of daily living. He has problems in that. Next, he also faces difficulty in his domestic activities like cleaning the house, taking care of the pets. Education might be hampered if he's a small age, younger age patient. Then employment issues are there. Then you have this social relationship. The bonding decreases between the husband and the wife. The leisure activities, the hobbies, and all these are affected. So based on the spinal cord injury segment, there is different problem list. So suppose sacral is involved, sacrum is involved, something different will happen. The cervical, something else will happen. We'll talk about this now. So once you see C1 to C4, if the C1 to C4 is segments are involved, then the breathing is affected and the head and neck movements are affected. If you see C4 to T1 involvement, there is heart rate control variability and upper limbs are involved. T1 to T12, the trunk control, temperature regulation, and abdominal muscles are involved. L1 to S1, the lower limbs are usually involved. S2, S4, or S5 level, you have the bladder, bowel, and sexual involvement.